We have some attendees on the line, and again, we encourage you attendees, if you have specific questions, you can put them in the Q&A chat, and our staff members are here to respond to those. And for City Council, I'll be providing an update on where we're at with the latest.
You are in the
Deb, you're still on. There we go. So I'll be providing an update as far as where we're at with the latest with COVID-19 and some of the national trends. We're seeing some of the latest data on COVID transmission, specifically in children and adolescents, since that's been such a major area of discussion across the country and here in Colorado and Broomfield. And then lastly, talking about the policy landscape, both at the state level and in the regional level. So Sarah, can you tee up our slides? If you could go to the next slide, Sarah. So some of our key takeaways, obviously, is that we're seeing this statewide, that we're seeing an increase in cases and hospitalizations among all age groups. And this is what we're seeing in Broomfield, that there's an increase in cases, and especially among the Broomfield children, the 6 to 11 age group. You all may have saw the recent articles in the Denver Post and other news outlets that hospital capacity is stressed. I want to emphasize we're not at a place where hospital capacity is being threatened. But this is due to a number of factors. And I think the key factor for us to keep in mind in Broomfield is while we may have low hospitalization numbers, our surrounding counties, as far as their community transmission, their vaccine rates, and the hospitalizations they have from those counties impact our larger hospital system just due to the sheer number of people that live in those counties. So if we have a lot of unvaccinated individuals that are going into the hospital system, that not only impacts those counties, that impacts Broomfield residents. And then lastly, as far as what we're seeing with COVID-19 and children and adolescents, there is definitely an impact of COVID-19 on children and adolescents. And I want to remain very factual and science-based with this. We know from the literature and studies that the children and adolescents are susceptible and can transmit COVID. You'll recall last year when we first started to track COVID with the original strain, there was a belief that children weren't able to transmit it as much as adolescents and adults. We're actually finding that children are able to do that. So that does impact our mitigation strategies for that specific population. Additionally, we see nationwide that children are less likely to seek out testing and medical care. And this is due to the fact that they may not have as many symptoms. They may be more asymptomatic than adults. So you're likely to potentially see kids that are not diagnosed that could be going into a specific setting and exposing others. I do want to emphasize, because this has been a key point, that there are definitely lower rates and significantly lower rates of hospitalization and deaths in children and adolescents compared to adults. What we're starting to see nationwide is there is an increase in hospitalizations, especially in our children and adolescent age groups, but we believe that's due to the sheer number of infections that are happening across the country, specifically related to the Delta variant, which is so highly infectious. So if you could go to the next slide, Sarah. As far as what we're seeing statewide, there's a slight decrease in our number of new cases in the state. We'll have to track and see if that continues to trend downward. We are seeing an increase in pediatric case rates. We've talked about this throughout the 99% of our cases across the state based on sampling are the Delta variant. And then lastly, hospitalizations are increasing. And again, this is largely among the unvaccinated. We are seeing pediatric hospitalizations, and this is complicated because we have an unusually high and early RSV prevalence that's happening across the state, which is impacting pediatric hospitalizations. Specifically in Broomfield, we're in elevated growth as far as our case rates. But what we're starting to see is our case rates, you'll see this in our trends, is starting to level off for the 7-day incidence. Same with that percent positivity. We've been hovering around this 5%, but it's not increasing significantly. 68% of our total population are fully vaccinated, and that's continuing to increase. I'll talk about this a little bit later. And then as mentioning before, is we're seeing more and more people that are being hospitalized across the state in the Denver metro region, and even some of the potential transfers from other states into our state that are having those surges of patients. It is impacting our hospital capacity. So we are seeing a 17% increase in COVID-19 patients over the past 7 days. The majority of our cases are among those who are unvaccinated, and I'll talk about this a little bit more. We are seeing more and more breakthroughs, and all hospitalizations in Broomfield were among the unvaccinated, and no deaths in August, which is good news. And then lastly, we have 253 breakthrough cases, but again, our highest prevalence in that is in our 30 to 59-year-old age group. Next slide. So this just shows what I was talking about before, where we're at as far as hospitalizations in the state. And you can see that we're already trajecting up, similar to what we were with the November and December peak last year, which is obviously concerning for us and something that the hospital system will continue to track. Our ICU capacity dropped to 18%, and so our North Central region is in level yellow. And then, as I mentioned before, the hospital system activated its combined hospital transfer center plan, and that's at tier 1. And just again, the ability to transfer patients between hospitals due to certain regions or hospital systems potentially being at capacity. Next slide. So when we talk about vaccine effectiveness and breakthrough cases, I thought it was important to really emphasize this because this is where we're at in Broomfield. The reality is a significant proportion of our population is vaccinated, which is awesome news. Again, 68% is fully vaccinated and 79% of the eligible population is fully vaccinated. But what you can see from this chart is as you start to see a greater proportion of your population vaccinated, you expect to see a greater number of breakthrough cases. And that's just based on the sheer fact of numbers. So again, we're at a place where we have roughly 79% of our population that's vaccinated, fully vaccinated in that eligible age group. And we would expect to see a greater proportion or percentage of our cases that are breakthrough cases due to that. And I've talked about all of the factors that play into that in my previous presentations, such as waning immunity, host factors, and more importantly, the virus as it continues to mutate and the impact it has on vaccine effectiveness. Next slide. The great news is what we continue to see is if you are fully vaccinated, your risk of being hospitalized is much lower than if you're unvaccinated. We've said this numerous times. The best thing you can do is go out and get vaccinated. And the best thing you could do to protect your family and your kids is to get vaccinated as well. Next slide. And this just alludes to what I was sharing with vaccine effectiveness. As we would expect, we're starting to see an increase in the number of breakthrough cases with vaccines. And that's just because we're seeing a higher percentage of the Colorado population that's fully vaccinated. So we expect to see this trend continue to play out. Key takeaway here is if you're fully vaccinated, your risk of hospitalization and death is significantly lower than if you're unvaccinated. Next slide. And I was talking about RSV and where we're at right now with that and potentially the flu season. And we've heard the stories from some of our pediatric hospitals and the potential impact that's having on them. And I think there's a couple of things to keep in mind with our pediatric hospital system is, one, this is a very specialized system. So it's not as easy as with some of the other hospital systems where you can just go and find a nurse that you can bring in. You have to have people that are very trained in being able to provide this level of care to these specific patients. So obviously hospital capacity, bed capacity, but staffing is a major thing that we want to keep watching. And I thought this graph was important because what you could see is our pediatric hospitalizations. And if you look at it due to influenza, RSV, and COVID-19, you can see where we've been in previous years and then where we were last year, again, June through March. And you can see where we're trending at this year. So in 2020, we did really good because we had a lot of mitigation initiatives in place. We had social distancing, capacity restrictions, masks, all the layered mitigation. What we're starting to see now is that's ticking up. And again, with RSV, we're really concerned because typically that is a virus that doesn't start to take hold until October and goes through the winter months. But what you can see, it's starting much earlier this year. So we'll continue to watch that to see if it rises at a significant rate and the impact it'll have on pediatric care. Next slide. And this is just something nationally that's showing, as I mentioned before, that we're seeing a increase in pediatric patients that have been hospitalized. And this is specifically data from August 2020 through August 13th, 2021. And what you can see is over the pandemic, we're at a place where we are seeing our highest percentage of those pediatric populations that are hospitalized. And again, I mentioned there's many factors that play into that. One is we have a much more transmissible virus right now, the Delta variant, and we just have a significantly higher increase in cases. You have RSV that is also potentially playing into this and some of the loosening of our mitigation factors. Next slide. And then this just shows what we're seeing in Colorado as far as pediatric hospitalizations. And again, when you look at the graph, I want you to pay attention. Our 7-day moving average ranges between 0 to 15. So I don't want the graph to scare people to say we're seeing significant increases, but what you can see is that we're seeing slight increases, especially in our 12 to 17 population in our 0 to 5. The next slide. And this is what we're seeing with case rates, similar trend. And I think as you would expect, we're seeing an increase in case rates, specifically in that 6 to 11 population, 12 to 17 and 0 to 5, but it is sort of trending along with that 18 plus age group. And so we'll continue to track that to see if that changes in the state. Next slide. And here's what I was mentioning as far as in Broomfield, our 7-day cumulative incidence is starting to trend down. We hope that this trend continues, but as we've known through these surges, we'll just have to watch that over a couple of weeks and see if it continues to go in that direction or if we start to trend up again. Next slide. And this graph is a little bit hard to read, but this just shows those age groups where we're seeing the greatest percentage of cases. And so it's primarily in our 6 to 11 age group and in our 30 to 39-year-old age group. And we thought it was important not only to put the rate, 7-day incidence rate per 100,000, but also the cases next to that. Given that Broomfield has small numbers, we're fully aware that these numbers can fluctuate up and down. But we look at the overall trends. And if you look at the, again, 6 to 11 age group, that line is pretty clear as far as what's happening in that population. And next slide. And then this is just even breaks it down further. Same message I was saying before, that we're seeing, we saw a steep increase in our 6 to 11 age group population. So as far as vaccines and where we're at, we have 79% of our population that I mentioned are fully vaccinated, continue to be in the top 5 as far as the entire state. 68% of our total population is fully vaccinated. It was good to see this month that we had 1,385 additional vaccines that went out. And 1,000 of those were people that initiated vaccines. So we hope that trend continues. And what's great in Broomfield is we continue to see people that are not only initiating, but completing their vaccines. Next slide. As far as where we're at nationally with the vaccines, as you all may have heard in the news, Pfizer, the Pfizer COVID vaccine for 16 plus was issued full FDA approval on August 23rd. That's great news for 2 reasons. One, we know from some surveys that some individuals have been holding out and waiting to see and waiting for that full FDA approval before deciding to get their vaccine. And we believe that for those specific individuals, this may be enough to push them to go do it. The second thing is there's quite a few private companies across the country that are looking at how do we maintain a healthy workforce, and those specific private companies are looking at vaccine requirements for their employees, not only to protect their employees, but the public that they're interacting with. We've talked a lot about the 3rd dose recommendation from the immunocompromised, so I won't go into that again. And then the big news is the booster shot. We're expecting for that to be rolled out around September 20th. The advisory committee on immunization practices is meeting to discuss that data. So that data will drive ultimately what the booster doses look like. Their next meeting is August 30th. And then again, the Department of Health and Human Services has announced a plan for the booster shots, but they're going to let the FDA data and the Advisory Committee on Immunization Practices data really drive what that looks like. If it's truly you get your booster shot 8 months after your last shot, or if they see based on the data that needs to be changed, and there's some discussions if it should be 6 months or if it should be 8 months. So we'll just have to see where that goes. We're continuing to work with the state on what that rollout plan will look like. The full assumption is based on our current network of providers, we'll be able to administer the vaccine through our infrastructure and network, and that we in Broomfield Public Health will be filling more of a gap filling role versus setting up mass vaccine clinics at this point in time. Next slide. So we've talked a lot about school-based mitigation efforts and the need for those. And these specific points, I think, were important for us to highlight because a lot of the discussion right now has been solely on masks due to public health orders being issued by us and other surrounding counties. But when we work with our school districts, we look at definitely layered mitigation. And these are the recommendations that we provide. First and foremost is all students that are eligible for the vaccine and those staff should be getting vaccinated. That's the best protection we could provide within the school setting. Secondly, families should make sure their children are up to date on all their vaccines. So we know there's not just COVID, but going into the school year, there's other vaccines we want people to make sure they're up to date on. As a family member, the best thing you could do to prevent transmission in your household and also your adolescents or children from potentially getting it is to get vaccinated yourself. And then, as we all know, the recommendation from the CDC and other leading scientific organizations is children over the age of 2 and adult staff should wear face masks, regardless of whether they're vaccinated. And the research shows if we follow this multi-layered approach, that it definitely reduces spread in COVID. COVID in schools, I apologize. The other thing that's happening, and we get a lot of questions about, is when will vaccines become eligible for children under the age of 12? Those clinical trials are still underway for children. They are, as they're looking at this, paying very close attention to the special considerations for vaccine development and safety in children. And that's because based on body composition and other factors, they have to make sure they have the appropriate dose and overall safety. So we're expecting data from the vaccine companies to be submitted sometime in the end of September to the FDA. But then the FDA will go through their full approval process, just as they did with the approval of the other vaccines. And then once it is approved by the FDA, it'll go to the Advisory Committee on Immunization Practices. So we all keep hearing a time frame, late fall, potentially early winter, and that's all dependent on what that review process looks like. The next slide. And I just wanted to let you know that the state is tracking what's happening in other states. So the state of Colorado, as far as the impact of masking policies on case rates. And this is specifically from Georgia, again, where they had a huge number of community transmission due to the Delta variant. But what you can see is the impact on case rates between those districts that did have a mask policy in place versus those that didn't. And then if you go to the next slide, we see a similar trend in Indiana as far as the same type of trend. And again, I don't want to say this is totally conclusive. There's many factors that play into this: vaccination rates, community transmission, other things, but it is epi data that is being tracked to help inform policy across the state. Next slide. So as far as the statewide policy landscape, the State Board of Health will be meeting actually today, and they're considering rules that are requiring COVID-19 vaccine for staff in specific healthcare settings. This was a request that the governor made to the State Board of Health. We'll see what happens with that, but it would be those settings where you have high risk populations and again, those staff that are providing services to them. And then the state mask order is set to expire on September 1st. We're still waiting to hear if they're going to extend that public health order, and if so, what it would include. And then lastly, here's what's happening in our surrounding counties. And you could just see what our surrounding counties are doing. I do want to call to your attention that Jefferson County did modify their mask order today to make up for those age 3 and older. And then Tri-County passed a mask order very similar to ours, ages 2 and 11, but allowed counties to opt out. And what they saw is that Douglas County and Adams County both opted out for different reasons. So they're bringing that back to their Board of Health today for consideration, and we'll have to just see where that goes. Next slide. So with that, that concludes my presentation, and I'm happy to take questions from council members. And I see we have Q&A in the chat if our staff could answer those questions as well. So if you don't mind raising your hand if you have a question, council members. Councilmember Schaaf.
Thank you, Mr. Balling, and thank you for the reports. I just have one question at this point. There was you had talked about the vaccine for under ages of 12. Is that going to be a full, do we anticipate that's going to be a full approval, or is that going to be an emergency authorization only?
Great question, Councilmember Schaaf. My assumption would be that it's going to go through the same process as the other vaccines, where they'll do an emergency use authorization, and then once they gather more data and go through the full review process, make a fully approved vaccine. Okay,
and just kind of to head off maybe some of my future questions in weeks ahead, with the emergency, we saw the Pfizer vaccine that they just had full approval, non-emergency, a full approval. Was there anything that was changed between what was approved for their emergency authorization and their full approval? Was there any difference in that?
No, there wasn't. So again, the approval process is a fairly lengthy process for these vaccines. And as they went through reviewing the data, the FDA, they were looking both at safety and effectiveness. Again, very safe, very effective for those mRNA vaccines, specifically the Pfizer one. And the other thing is we're seeing this play out across the entire country and the world, where you have millions, if not billions of people that are being vaccinated, and the adverse events that are happening from them are happening, but at a very, very, very low rate.
Okay, great. Thank you for that. Yeah, and I guess I'll ask one more question. So we saw that Pfizer got the full approval. Moderna, at this point, we anticipate that that's going to move forward for full approval, and Johnson & Johnson, that those will go move forward for full approval. Are you seeing any timeline in which those are moving forward at this point?
We are, and actually, Deb, I'm not sure if your microphone's working now. Deb was the one that had tracked this down for me.
Can you hear me now?
Yes, there you go.
Sorry about that. And just real quick, could you repeat the question? I was manning the chat too, so I'm sorry.
Yeah, thank you. So just we saw the full approval for the Pfizer vaccine. Do we know what the timeline looks like for the Moderna or the Johnson & Johnson vaccines?
Yeah, and I apologize after taking that long to get on here. I don't know an update on timing. We just know that, Pfizer is moving more quickly than the others. So let us get back to you on that. And if I do get that answer while we're meeting, we can put that in the chat. I'm sorry about that.
That's all right. Thank you so much. That's all I have, Mr. Balling.
Thanks, Councilmember Schaaf. Other questions from council members? I don't see any. What we we'll do though is we'll continue to answer the questions and answers that are coming through and make sure we're responsive to those. And with that, I'll let the council members get time back in your day. So we appreciate you guys joining for us for this council update, and we'll look forward to the next time we can provide an in-person update. Appreciate your time today.
Thank you, public health team.
Thanks. And we'll stay on again to answer the Q&A documents just to make, or questions to make sure we get them all responded to. Thanks, everybody.
Yeah.
Hey, Deb, I was noticing it looks like the remainder of our questions are from one individual. So maybe we could just take all of those questions and put them together in an email and send it to that person.
Yep, that works, and I apologize, they just were coming in faster than I could get responses on. So apologize for keeping everybody waiting. So yes, I will cut those out of the chat and we'll respond to Chris directly, and then just finishing on the one about antibodies.
Great.
Great. And Deb, I know Pat's out this week, but if Christina and I can help you out in any way, let us know. Okay?
Thanks, Nancy. Thanks, everybody. We appreciate your time today.
Sarah, I was just going to ask, Sarah found something on, is Councilmember Schaaf still on? Nope. All right, we'll have to do a follow-up on that.
Hey, Jake, you could probably go ahead and end the recording too.